Hey everyone, it's Dr. David here, and today I am bringing you Dr. Dave Candy. He is the author of this book here on chronic pain. You're not just getting older, you're not crazy, and it's not all in your head. Dr. Dave Candy is the owner of More for Life Clinic in St. Louis, Missouri, and of course, he's the author of this book and a subject expert on chronic pain. I read this book cover to cover. It's such an easy read. You write so conversational. So I really enjoyed it. So anyways, we're going to get to know more about Dr. Dave Candy and his book for sure. But tell us a bit about yourself, please.
Well, as David said, I live in St. Louis, Missouri. I'm a transplant here, didn't grow up here, but I've been a physical therapist for over 15 years now. And, I started out wanting to help, sports people just like, most athletes do when they go into physical therapy school. But somewhere about a year or two into my career, I found out that the things that everybody does that you're taught in school, they help some people, and then there's this small handful, 10-20% of people that just don't get better. And that didn't sit well with me, that I really wanted to find out how I could help people, those people who just, they're not getting better with the traditional approaches, and they've tried the traditional physical therapy, they've gone to massages, therapists, and chiropractors, and they've had injections or possibly even surgeries, and they're still suffering with pain. And I thought there had to be a little bit more out there. And so I wanted to dig deeper into that. And so really got into the chronic pain world. And that's now primarily my focus. It's the main patient group that I treat.
Awesome. Thanks so much for sharing that. Now, of chronic pain problems, which can affect the entire body, me personally, at my clinic, I see a lot of back pain patients. Next after that would probably be hip and knee. What would you say is the most prevalent body part that gets chronic pain in?
I think you're right. I think the back is by far number one. 80 to 85% of people have back pain at some point in their life. And a good, 20% of people are in chronic pain that's lasted for longer than 3 months at any period in time. So there's just a huge epidemic of back pain or chronic pain, and particularly chronic back pain.
Yeah. And you defined chronic pain in the book, by the way, and I wanted to just have you share that here because I think that's confusing for a lot of people that have pain, because everybody gets pain at some point in life. But what exactly determines if it's chronic pain?
So chronic pain basically is any type of pain that has lasted longer than the normal healing time, longer than you would expect for that particular injury. Typically, it's referred to as longer than 3 months or longer than 6 months by some guidelines, but really it's anything that has exceeded the normal healing time for a particular problem. And the pain that most people are used to, acute pain, like you twist your ankle or you fall and you sprain your knee or you hurt your back lifting something, and you wait a week or two and it goes away. That is very tissue-based pain, that your tissues are sending a signal to your spinal cord, and that your spinal cord sends that signal to your brain, and your brain recognizes that there's a problem. It does the right thing about it, and the problem gets better. In the case of chronic pain, that system breaks down a little bit, that the signal that your brain is receiving from your tissues, it isn't always proportional to what's actually going on in the tissue level. And so it can make the pain last a lot longer than it should. It can make you worry a lot more about it than you should. And ultimately, chronic pain is not driven always by the tissues. It has a lot more to do with your nervous system. And we discuss that in a lot more in depth in the book.
Awesome. Yeah, that's definitely what we get a good deal of. I think what I see more is people that have had off and on back pain. It comes and goes. It may have started when they were younger, like when they were in their 20s or 30s, and then as they get into their 40s and 50s and beyond, it just seems like it's harder to shake when it comes on. Like they get a flare up, and when they could just stretch and take some pain medication and rest it before and be over it within a few days, maybe a week at most. Now it's hanging out for a month or several months, and I think would you say that that's when they started going into the chronic pain part of back pain, like when it's been there for several months?
It is, and actually, the type that you're describing is chronic recurrent pain. The symptoms aren't always continuous, but it's the same problem that's been going on. And if you think about it, kind of like the cardiac system, that you can have high blood pressure and high cholesterol for years and never have symptoms, but then suddenly have a heart attack. And so just because your symptoms have gone away when you're having that acute pain in your 20s or 30s doesn't necessarily mean that you've fixed the problem. And the further you go into life and the more episodes of that on and off back pain that you have, the more those symptoms start to rev up and become the cardiac equivalent of angina or eventually a heart attack.
Mm-hmm. Awesome. Well, what got you into chronic pain? Because that's not something that everybody focuses on. As far as like, I'm a physical therapist, that you're a physical therapist as well. A lot of them will focus on, the acute problems or post-operative problems. Acute meaning like you just got pain now, or kind of the quick fix stuff. But chronic pain is its own specialty because, like you said earlier, there's so many different facets to it. And as you wrote in the book too, the biopsychosocial parts of it, like how it all connects to it. I loved how you put it succinctly, and you had the Venn diagram with the overlapping circles. I'll see if I can flip to it here, where it highlights like the bio part, the psycho, like what's in your head. Here it is. And then the social part, like there we are, for those of you online, how your relationships are. So what got you into this?
Yeah, well, initially I was like probably most people who go into physical therapy, especially athletes or ex-athletes who go into physical therapy, that I wanted to work with athletes and people who got injured doing sports. And I actually did my undergraduate in athletic training with that intent. But early in my career, I just found out that there was a subset of people that didn't get better. And I got a lot more fulfillment out of fixing those complex problems, particularly early on when I kind of lucked into it and got a patient that said, man, I've been to 5 different people and you were the first one that helped me. And that was really pretty fulfilling, but I couldn't do that all the time initially. So I had to go get more training and learn more about chronic pain. And, the more and more you learn and the more experience you get treating people with chronic pain, the more success you get.
Mm-hmm. Now, let's talk a bit about the typical pathway that somebody with, say, chronic back pain, the typical pathway that they have to go through in the medical field. What I often run into is stories like, well, this back pain's been going on for a while, so then the doctor gave me an x-ray. They found a few things, a herniated disc, some arthritis, nothing they want to operate on. Then I went ahead and MRI. We tried pain medication, like oral pain medications. We tried an injection. They're talking surgery, maybe like a discectomy for that herniated disc, or a fusion where they put the rods and the screws in. And it just goes sideways for people at that point very often. Now, what would you say that's kind of the typical pattern, or do you want to add to that or change it a bit?
No, that's very often the typical pattern that people do go through.
How is it different what you're doing? If you can just overview it a bit.
Sure. So, really the best pathway for people to go through, and there are studies to show this, is that the earlier people can access physical therapy after an acute back problem, usually the quicker the outcome and the less it ends up costing in the medical system. So you end up paying less. When you go through this typical route that you've described, you end up having a doctor's bill, usually some medications, usually some imaging bills, whether that be x-rays or CTs or MRIs. And you still haven't really gotten to, anything that's really helped fix the problem yet. And, when we look at people, we don't necessarily look at which discs are herniated, or what your x-ray looks like, which joints are out of place if you're talking about it from a chiropractic standpoint, but really more on the functional things that you're doing in your everyday life that are causing the pain, whether that be sitting too long or whether that be standing or walking for long periods, or whether it be, you can't sleep well at night, or you're stiff getting out of bed in the morning, whether that be, you feel fine when you're sitting down, but then as soon as you go to stand up out of a chair, you start having problems. And those all lead us to different mechanisms from the bio part of it, from the structural standpoint of what's going on at your tissue levels. And there are many, many, many studies that show, not only for your back, but other parts of your body as well, that what's shown on your x-ray or your MRI doesn't necessarily correlate with your pain level. That there are a lot of people who have bulging discs, herniated discs, degenerative discs, who have no pain at all. There are people with horrible knee arthritis that have no pain at all. And there are people with pristine looking x-rays and MRIs that are in just excruciating pain. So we try to look beyond that tissue level, and from the bio part of it, find a movement problem that's creating it. And the good thing about that is that you can't control a herniated disc in your back. You can't make that unherniate. You can't undegenerate a disc. But if you're sitting wrong in a chair, you can fix that, and that gives you some power. And a lot of times that helps people who have back pain to get some more control under it. And one of the scariest things for people who have back pain or any type of chronic pain is just sort of the unpredictability about it, and the worry and the fear about, is this going to be here forever? How long is it going to take to go away? Is this going to stop me from working or playing with my kids or grandkids? And really that worry and that fear is what drives chronic pain. That's the psychological part, the things that you think about in your mind, and the social part, the way that's going to affect your social interactions. For example, working or playing with your kids or grandkids, or being able to play in the baseball game, or being able to go out golfing with your buddies. All those ways that it's going to affect your life, and the worry and fear about how you're going to be able to participate in life, those all kind of drive the chronic pain. So we help to try to give people more control over their problems so that they're less worried about it from the psychological side, and also help reintegrate them into the things that they want to be able to do. So getting out of a chair easier, or swinging a golf club without their back hurting, whatever the specific functional problems that people are having, the things that are really going to add value to their life, the quicker and sooner we can give them some control and get them back to doing those things without having pain, the more successful they are in their treatment, the more happy and fulfilled they feel, and the more likely they are to get better and stop worrying about things as much.
Awesome. Thanks for sharing that. That's awesome. I have your book here, and I'm open to the chapter on back pain specifically. I'm interested in that. And you give so many practical tips. I love how it's laid out too, where you educate about like the anatomy of things and how it's connected. And you go into some good research as well, some details. But if you're open to sharing like one tip on something that people, the viewers here, can do for chronic back pain, what's something that you'd recommend if you just had a quick minute to share something?
Sure. Well, I think probably one of the most common tips, and I will mention that there's some links in the book. We've got our own YouTube channel that has a bunch of videos on it as well. But one of the most common things that people have problems with that causes back pain is a well-intent thing to sit up with good posture. That people are told when they have back pain that you should sit up tall. Their mom or grandma or whoever tells them don't slouch from the time they're young. And really, there's no evidence based to show that that's necessarily good. A lot of it's based on Victorian era etiquette, where women should sit up nice and tall and not slouch and look ladylike. But there's not really a lot of good proof that that's good for your spine. There's some old evidence that being in a flexion position, like a forward bending position, puts more stress on the discs. But again, your discs aren't necessarily correlated with the pain that you're feeling. And so one thing that a lot of people with back pain end up doing is they try to sit up really tall or stand up really tall, or like sit up tall and not slouch. And what that does, it kind of jams your joints together. And particularly as you start getting up in your 40s, 50s, 60s, and beyond, you do start losing some height between your discs, and your vertebrae get closer together. The joints, the facet joints, kind of start to push on one another. And when you sit up tall, when you stand up tall, that actually narrows the spaces where the nerves come out of your back. It narrows the spaces between the facet joints. And it can actually make the back pain worse, particularly in people who are over the age of 40. So some things that people do with good intent, standing up tall or sitting up tall, they don't always help the back pain, and in some respects, they can make it worse. So one thing that I tell people frequently is if you're sitting in a chair, make sure you sit all the way back in the chair. Let your back kind of relax into the chair, and make sure your feet are up on a footstool so that your knees are at least at your waist height. And for some people, they have to be even higher up, which puts your back in a little bit more rounded of a position. But for a lot of people, that feels good. And listening to how your body responds to your positions can help you, because somebody who has a true herniated disc, that's the cause of their problem, and it's causing a referral down into their leg. Sitting with a rounded back might not be good, but for I'd say over 50% and well over 50% of people age 40 plus, that sitting with your back kind of rounded makes people feel a lot better. And same thing when you're standing, not standing with too much arch in your back makes people feel better. So that's just a quick, simple tip that works for a lot of people. Not everyone, but a lot of people.
I have the same recommendation for my clients. I think I've talked about on this YouTube channel before as well, how over correcting your posture. I love what you said about the Victorian era thing. That really is something that's just been carried on and has no medical foundation whatsoever. And honestly, I find people tend to be over corrected in their posture, and then they start getting more problems because of it. And I always feel kind of contradictory to culture whenever I tell people you kind of need a slouch, like that's going to be the best thing for you, and they do it and they're relieved and they're like, oh, I'm so glad that an expert has told me to slouch. Now I have confidence going against my mother or my father or whoever's telling me to sit up straight.
Yeah, absolutely.
Well, thanks for sharing that. This was a great interview. Thank you so much for putting together this book and putting your knowledge in there. Like I said, everyone, the link is in the description below to get to Dr. Dave Candy's book. Now, who's this book for? I mean, obviously people in chronic pain, but is there like a certain age group or certain demographic that this is probably going to benefit them the most?
Well, it probably is primarily for people age 40 plus. I describe in the book a story of a patient, not like a super special story, but like kind of an everyday story that I hear. And it's of a specific lady named Mary, who was a 68-year-old woman and just kind of had that gradual course that you described, where intermittent episodes of back pain that gradually got worse and took longer to go away. Tried medications and chiropractic and regular PT and massage, and just over the years things got worse. And so really people like Mary, whatever path of life they've gone through, that age 40 plus, primarily female, who has just had back pain episodes that have gone on for 5, 10 plus years and haven't gotten better. That's probably going to be the person that is going to benefit most from this book. But I would bet that just about anyone who's dealt with some sort of pain that's lasted 3 months or longer could find 1 or 2 actionable tips somewhere in the book.
Awesome. Great. Well, thanks for your time. Thanks so much for coming onto to our channel here. For those of you that haven't met me, I'm Dr. David Midoff, and I've got this channel here completely focused on helping people stay healthy, active, and mobile while avoiding unnecessary surgery, injections, and pain medications. And Dr. Dave Candy's book is right down that alley. So go get his book. You can reach him at his clinic, More for Life. He's in St. Louis, Missouri. And let me just get the name of the clinic on. It's there on the bottom now on the ticker. And you can get to him through the phone request. So it's drdavecandy.com/phone-request. So if you wanted to potentially talk to him and see about doing like a telehealth visit, an over the internet visit, he might be able to help you out with your chronic pain problem. So thanks so much for coming on the show. And I appreciate your time. And for those of you watching, I'll see you in the next video. Bye-bye.